Hello, my name is Sophia. I'm part of the Behavioral Health Department here at Found Care, and I'm here with our physician, Dr. Thys, who we are very fortunate to have collaborating with us on this diabetes project. I will be asking Dr. Thys here some questions, some common questions that most patients have when they are recently diagnosed with diabetes. So that brings me to my first question. Dr. Thys, what is diabetes?
In diabetes, you have an organ called the pancreas, which normally produces insulin to help glucose get into the cells so that you can use energy. And with diabetes, either the insulin is not being produced, or the insulin that is produced, your body does not respond well to it.
And so I know there are two types of diabetes. What is the difference between type 1 and type 2?
So in type 1, generally that appears in the younger population, or starts at an earlier age. And in type 1 diabetes, the body attacks its own pancreas and there's no insulin being produced. And with type 2, the onset is at a later age, so it's mostly older people, somewhere around their age 40. And the insulin that the pancreas produces, the body is somewhat resistant to it.
Would I need medication to kind of manage this disease?
Yes, well, it depends. If the disease is not in an advanced state, you can control with diet and exercise alone. But as it progresses, people will need medication, whether it's oral medications to help the body control the blood glucose, or insulin, which is injectable or subcutaneous.
Let's say I do need the medication. Would I need to take the medication on days that I feel fine?
Absolutely. Whether or not you feel good or not, it's always important to take your medication daily.
With the diet, what importance does diet have on the diabetes? Would I need to stop eating my favorite foods?
Well, not necessarily completely to stop eating your favorite foods, but more in moderation and controlling how much carbohydrates you consume, because that will convert to sugar in the body. So diet and exercise has an very important role to play. As you exercise, your muscles will need sugar, so that can go a long way in controlling the blood sugar.
How will the disease progress?
Well, in the early stages, you don't really have that much damage to the body, but as the disease progresses, it can affect important organs such as the eyes, the kidneys, and the small blood vessels that are responsible for circulation throughout the body.
What are the warning signs of having too high of a blood sugar level or too low?
Very good question. Having too high of blood sugar or hyperglycemia, people can have various symptoms, including feeling fatigue, having a lot of weight loss, or what we call the 3 Ps, polyuria, polydipsia, and polyphagia, which basically means that you feel very thirsty, so you drink a lot more, you feel very hungry, or you eat a lot more, or even producing a lot more urine, so you're going to the bathroom to urinate a lot more often.
And then the lower blood sugar levels, are they similar, the symptoms?
Yeah, with hypoglycemia, which is typically defined as a blood sugar less than 60, people can feel very shaky, they can feel very sweaty, they can even feel dizzy or actually pass out.
Okay. And both are equally as dangerous?
Absolutely. We do not want people to be hypoglycemic, okay? The reason being is because if you pass out and there's nobody around to help you, then you can go into a coma, and that can be very dangerous.
How often should I test my blood sugar?
So blood sugar should be tested enough so that you can get a good range and to know exactly what it is. So in the morning, fasting levels, generally your blood sugar should be in a range between 70 and 130 milligrams per deciliter. And 2 hours after eating, in general, you do not want the blood sugar to be too higher than around 160 or 170.
So does having diabetes mean that I'm at higher risk for other medical problems?
Yes, what's important to understand is that having diabetes is a risk factor for certain things such as cardiovascular disease. So having that puts you at an increased risk of having a stroke and having a heart attack as well.
Is my family at risk for diabetes?
Well, there is a genetic component to diabetes, and we do know that certain populations are at increased risk for developing diabetes. we do tend to see that there is a genetic correlation so that people are at increased risk of developing diabetes later on in life.
Would you say that there's a cure for type 1 or type 2 diabetes?
So there's no real cure. It's more of managing the disease, okay, by making these important lifestyle choices. And I think more importantly, to give patients education so that they understand that this is something that they will be doing regardless whether you have the disease or not, something that you want to be doing for the rest of your life. So eating well and exercising.
That's very important. Thank you so much, Dr. Thys, for taking the time to answer these questions for us.
Absolutely, my pleasure.
If you have any more questions about diabetes or the Diabetes This initiative that we're doing here at FoundCare to help our patients manage their diabetes, please visit our website at foundcare.org under services, or please feel free to consult with your primary doctor. Thank you and take care.